perfect.
Thank you. Thank you. Uh, Hello, everyone. And let me assure you, I have been a proud part of the South Delhi Homeopathic Association ever since I was a grad student. And it shall not be wrong if I say that I am one of the offsprings of South Delhi Homeopathic Association. And whenever I'm commanded to speak something, I have to comply because a lot of members are my seniors and my teachers. And the best part is that you always listen to whatever I have to speak. Thankfully, thankfully. So I start my topic today. It's on the disease, its phenomena, and anamnesis. Uh, as a country, we are currently going through one of the first clinical crisis when we have so many COVID cases going on. The numbers are increasing, escalating by the hour, and we, being the silent unsung heroes, are also treating a lot of COVID patients. But it is all the more important that, rather than following for routine prescribing, if we want to succeed in help these cases, we understand the phenomena of disease as per homeopathic philosophy and guidelines. So that's why I intended to, because it is most imperative in the current times while we're dealing with COVID-19 or its fallout or sequelae, and otherwise also in our day-to-day clinical practice. So first, just a small introduction about the concept of a disease, which we all know is any deviation from the norm. Whenever there is any pathophysiological change happening in the body, or even if there are abnormal sensations, functions. And this is where you have the concept of disease, where you actually find clinically relevant changes. And then there is a concept of illness. Illness is when a person may not qualify as a diseased person, but the sense of well-being is lost. And then you have the concept of sickness. Sickness is what are the social-cultural contexts of illnesses. But the interesting part is that the concept of disease has always changed according to the social-cultural context. For example, a couple of years back, osteopenia or osteoporosis, what was considered to be a normal sign of aging, ever since 1994 has become an officially recognized illness. And most important is that how do you, if the person is not having pathophysiological changes, but has a strong family history or is exposed to numerous epigenetic factors or environmental factors which can predispose him to a disease condition, can we classify him as a healthy person? Or will we only classify him as a diseased person once we have structural or pathophysiological changes happening? So another aspect about disease today, which is coming a lot in fore, is the changing, emerging context of diseases which are being made in order to match the drug development. I will give you an example of a new term which has come up in the concept of illness or disease today is female sexual dysfunction. And you'll be surprised to know, ever since Viagra was introduced and the way it helped people with erectile dysfunction, the pharmaceutical sector did not want to let go of the advanced gender or the female gender, and that's why they introduced a term called female sexual dysfunction, completely developed because of the pharmaceutical sector. But again, it's a questionable diagnosis. Then we have, something called a social anxiety disorder. Anybody who has a little bit of stage fear, when I say a little bit, it should not be overwhelming, should not be making somebody's life miserable in any social context or scenario. But they are now classified as people with social anxiety disorders. And even today, as we all know in our clinical practice, a simple phenomena as pregnancy, which is a normal physiological phenomena for a woman, is also classified or treated more as a disease phenomena. Now, when we talk about disease in general, we need to identify the different disease models. So the most prevalent disease model for the modern medicine has been the biomedical model, which identifies all the microscopic or tissue changes or pathological changes or organic changes purely and only identify those changes as the disease. On the other hand, when you identify the biomedical concept of health, then you are making certain assumptions that any illness will have a single underlying cause, which usually lies in those pathological or tissue changes. And therefore, all these changes, when they're reversed, they lead to the reversal of the entire disease process. And this is where this concept fails. Therefore, what we find lacking are all these psychosomatic illnesses which are manifesting in the human problem, because the biomedical concept, in the absence of tissue changes or structural or organic changes, fails to address these somatic illnesses and a lot of functional disorders that a lot of the modern world is subject to. And that is why this biomedical model of disease has been replaced with the biopsychosocial model, and which is in sync with the World Health Organization definition of health as well. From the concept of disease, we move on to the concept of anamnesis. So anamnesis primarily is one of those traditional concepts which is about understanding the evolution of any morbid process. Anamnesis is, in a simple translation, means to remember, to reminisce, to relive, to reiterate, to restate the entire onset of the disease phenomena that you have been subject, or your being has been subject to since the evolution. And like I said, it's a biblical concept because we find its reference in the Bible as well, where they talk about the anamnesis is the Greek derivative of the word which means to remember. So when it comes to the medical aspect, the anamnesis is primarily divided into two categories. One is anamnesis morbi, in which you talk about the time of the onset of the disease, you talk about the causation, you talk about the symptoms, their characters, the associated serological markers, the associated treatment and results, if any. And then there is anamnesis vitae, or anamnesis of the living being, in which you get the biographical data, you talk about the past illnesses, you talk about the habits, the family history, the social history, and any exposure to allergens. So with this background, now let us move on to the homeopathic perspective of disease. So in the very early part of the organon, in the first parenthesis of the third portion of the organon, Hahnemann talks about the knowledge of disease. But when he puts that in the parenthesis, he talks about knowledge of disease, which pertains to the textbook description of the disease phenomena. But what is more important, which is required for the individual assessment of disease, is what he writes after the knowledge of disease, and that is most pertinent part for the homeopathic physician, that is the indication. That indication that sets him unique from all the other identical morbid processes. And he explains further when he talks about the most significant points in the whole history. And then he talks about the ascertainable physical constitution, his moral intellectual character, his occupation, his mode of living and habits, his social and domestic relations, his age, his sexual functions, etc. And all of this is what uh, are later on explained by him as the accessory circumstances, which he explains further in the organon, though may not hold any significance for the sick person, but they are pregnant with meaning. Later on, he explains yet again about the indication that what needs to be identified in the sick person are only those deviations which are deviations from the norm, those deviations that nothing should be taken note of except that individual change in the health of the body and of the mind. So all those deviations, for example, if the patient has always been fond of sweets, that holds no significance. But if that craving for sweets is a concomitant to the onset of illnesses, then that symptoms becomes important. If a patient has always been lachrymose, has always been weepy, or has always been anxious, that personality trait holds little importance unless it accompanies the development of illness or that sickness. And only these deviations are what are to be noted in the understanding of the disease from the homeopathic perspective. And this is what he describes as a phenomena. So when we say the word phenomena, it means something which can be perceived or which is seen to exist and has a spatio-temporal existence, or it means something which can be perceived by our sentient senses, by anything which can be confirmed by experiencing. It is opposite to, there's another word called noumenon. Noumenon means something which is known instinctively, and phenomena is something which is identified, which can be identified by everybody by their senses. And this entire conception of disease in the homeopathic perspective is a phenomena which needs to be delineated or identified. Now, we have already seen what the medical anamnesis is about. But now, when we say the homeopathic anamnesis, how is it different? So, we talk about the time of the disease onset, but especially when we talk about the homeopathic anamnesis, we need to understand what were the circumstances that a person was exposed to at the time of the onset. So which includes the geographical factors or the climactic factors or the phase of the moon or the state of the mind, the place of work, the occupation, the situation at home. Everything needs to be considered for it to be a perfect homeopathic anamnesis. So last year on H-pathy, we published about 60 cases of in 3 successive editions of the journal of H-pathy. And in a few of the cases of COVID-19, we had prescribed Ignitia Amara because these were those personalities which were exposed to certain traumatic emotional experiences, and which led to the development of complaints, and all the signs and symptoms or the indications that developed in those COVID patients were also found in the materia medica associated with those emotional traumas, and then they received those remedies. For example, we prescribed Ignitia in one of the cases, we prescribed Staphysagrea in one of the cases, and these people responded to those drugs and recovered perfectly. Then we need to identify the most probable cause. The cause cannot ever be absolute. It can always be the most probable. Then, and those list of probable causes then become more pertinent when they comply with the effects. And when those effects and causation are matched in the materia medica, then they become important for prescribing, and only then can they be ascertained to be the most probable cause. Then the evolution of complaints, the direction, the affinity, the circumstances which tend to modify all the complaints or the signs and symptoms, the diurnal modifiers, the climatic modifiers, all the therapeutic measures that have been employed, and all the side effects which possibly can be attributed to those. So this is how homeopathic anamnesis for a disease part is different. So every symptom, as we say, has to be broken down into location and sensation and the modifiers, and that is required for the anamnesis morbi. And when those symptoms, whether they are pathognomonic or otherwise, when they become qualified by certain concomitants, then they hold more value. And then you have the anamnesis of the being. So not just the biographical data, but we require the entire pathobiographical data. We require the psychosocial aspects. We need to understand the past illnesses. What is important, especially from the homeopathic perspective, is the intrauterine history, the family history, the personal attributes and attitudes, all the personal, emotional, psychological or physical sensitivities and idiosyncrasies, all the behaviors, the behavioral changes, the behavioral attributes are what need to be identified in the anamnesis vitae. And as one of my teachers used to purely explain, that in order to perceive what is sick in the individual, you need to merge your being with the sick person, and that is when you identify. And this is what Hahnemann explains in Aphorism 83, that in order to understand this phenomena of disease, we require a freedom from senses, sound, understanding, attention in observing, fidelity in tracing the image of the disease. And because we are dealing with beings, with their peculiar dispositions, their behaviors, their attitudes, so we require more tact, circumspect behavior, knowledge of human nature. We need to be cautious while conducting inquiry, and we require patience in an eminent degree. And the disease, therefore, may not be seen purely as an isolated event, but as a dynamic happening in the entire evolution of the being. So just to give a few examples, for example, there's one patient who came to us with dyspnea grade 3 and 4 that developed because he was having metastasis of carcinoma prostate. But when we went into the evolutionary history, then we found that in 1985, he had first presented with abdominal pain. A few years later, he was diagnosed with polylithiasis. A decade later, he ended up with myocardial infarction. And then later on, in a few years later, the condition relapsed. A few years later, he became a diabetic. Then he developed anal fissure. Eventually, he landed with CA prostate. And when he finally consulted us was because of the metastasis of the prostatic cancer. So if we look at the entire medical history, we find that the patient was not well ever after 1985, because that's when sequence of illnesses started. This is one of my favorite quotes, that people are trapped in history and history is trapped in them. And nowhere it is more meaningful than in the homeopathic perception of disease or the homeopathic anamnesis. Another example, again, we saw this evolutionary history of a lady who presented with diabetic nephropathy. And when we went into the anamnesis, we found chickenpox occurring early in the childhood. A few years later, jaundice. A decade later, measles, then recurring episodes of malaria. Then she was diagnosed with lactose intolerance. Then she developed menopause early in her life. Soon after that, she was diagnosed with SLE. Then she became hypertensive. Then she was diagnosed with type 2 diabetes. Then she later on was diagnosed with hypothyroidism. But that hypothyroidism occurred as a side effect of the allopathic medication that she was taking as an antihypertensive. Couple of years later, she developed with diabetic ketoacidosis, and eventually she presented with diabetic nephropathy. Now, what happens is that throughout this time, she had been going to the specialists and super specialists. She was consulting doctors regularly. She was regularly on medication. She was always being advised the nutritional and dietary and lifestyle changes. But what Hahnemann describes in the chronic disease, that it is a persistent, relentless, progressive disease process. And this is what we find when we do the evolutionary analysis or the anamnesis of the case, that it never stopped progressing. None of the treatment was ever therapeutic. It could not stop the progress of the disease or the morbific disease morbific influence, or her miasmatic trait, as we identify in homeopathy, could not stop that morbid disease process. Why is anamnesis important? Because people usually say that Elizabeth Wright Hubbard said the case well taken is half cured. I don't know. I tried to look for a lot of references, could not really find any. But I do know that Henry Clay Allen used to say a case well taken is 9/10 prescribed for. So now I share a few clinical experiences on the basis of our understanding of disease from the anamnestic point of view. So about 2 years, a little more than 2 years back, we saw a little girl who was 19 years, teenager, and thin-built, thin girl of average build, dark eyes and hair. And she came along with her mother and an aunt, and they explained that, since childhood, every change of weather or sitting in a cold environment for long, or after cold drinks, or even after menstruation, she would suffer with nasal obstruction or nasal discharge, which was usually followed by a headache, a body ache, and a pain in the neck. The temperature used to rise up to 100, 101. And a day prior to the onset of fever, she always noted that the sense of smell and taste would decrease. So she knew that she was not having COVID, but she knew that she would be down with fever. And there was a yellowish nasal discharge that followed. Apart from that, her menstrual cycle had always been regular, but last few cycles had started getting delayed. The flow was average. There was no clotting, used to last for 6 days. No major change in that. But every time before the menstrual cycle, she used to feel a backache. And for last 1 year, there was darkening of skin over the nose and the cheek area. And the pain used to continue during the menstrual cycle as well, along with pain in the right anterior thigh and right calf. So family history was not too alarming on the father's side, but on the maternal side, we found a lot of endocrinological imbalances and hypertension and diabetes, and paternal grandfather had suffered with tuberculosis. Her water intake was, as the mother and the aunt confirmed, that she had to be pushed to take a liter of water, but a lot of times it was less than a liter of water. And they said that, if we do not push her, then she will not take. She preferred having normal water because cold water used to make her upset. It used to trigger a sore throat or a nasal complaint. She was vegetarian. She would be okay if the meal was delayed, but it invariably led to a headache. She preferred winters And she felt suffocated, especially when she used to perspire, and she used to perspire more on the face. She preferred having rice and kidney beans and chickpeas. She preferred paneer, salty, but none of these changes had modified or had changed. None of these desires or cravings or likings had modified over the previous years. But none of these was also very intense or striking. She avoided having sweets and fruits. She preferred sleeping on the abdomen, and the sleep times were usually erratic. And if sleep was less, then she used to have pain in the right calf and right tail thigh, and that was more marked around her menstrual cycle. Uh, she had a full-term normal delivery, and her birth weight was about 3.15 kgs. Because the mother did not lactate enough, so she was given mostly top feed. She had normal milestones. At the age of 1 year, she suffered with pneumonia. When she was about 3 to 4 years old, she suffered with typhoid. At the age of 7 to 8 years, she had malaria. And then she developed herpes zoster at the age of 8 or 9 years, which is rare, especially since she was a child. Then we went into the intrauterine history, where the mother informed that it was a planned conception. The parents were ready for a kid. Prior to her, there was a spontaneous abortion because the mother had lifted something heavy. Throughout the pregnancy, the mother was normotensive. There was more of vomiting and less of nausea. Fourth month of gestation onwards. In the first trimester, there was no nausea or vomiting. And also in the fourth month, the mother developed gestational diabetes, and therefore she was on strict diet control. And she said she did not require a medication. Simultaneously, she also had puffiness in the body. Because of the strict diet control, the mother gained about 7 to 8 kg only. But if you recall, in the previous slide, it's shown that her birth weight was about 3.15 kg. So she was developing well. Mother preferred having sweets, which she usually disliked. But she said that probably that craving for sweets was also because she was restricted from having anything sweet. And in the 8th month of the gestation, she developed severe chickenpox. So when we see it from the anamnestic point of view, the mother had gestational diabetes. Then she suffered with a severe episode of chickenpox during the 8th month of gestation. The kid develops pneumonia at the age of 1 year, typhoid when she was 3 to 4 years old. Then she had malaria at the age of 7 to 8 years. And then an year later, she develops herpes zoster on the right gluteal region. And currently, she was consulting primarily for the last few delayed cycles and symptoms which seem more like chronic sinusitis. So keeping in mind the severe episode of chickenpox and the baby developing herpes zoster later on, we prescribed melantronum LM1. Melantronum is one of those remedies which is known to remedy chickenpox and its effects which develop in the absence of indication for any other remedy. So she received ascending LM potencies of melantronum over time. So soon after we started the treatment, she went for a CT scan of sinuses, and we found maxillary sinusitis. But under the effect of the remedy, gradually her sensitivity to cold went down. The episodes of recurrent upper respiratory tract infection disappeared. And about a year later, when we repeated the CT scan, then the sinuses had cleared completely. There was only hypertrophic turbinate, but the episodes of cold or recurrent cold with fever had died down completely. Also, the complaints during and around her menstrual cycle also disappeared. And then that's when we asked her to stop the medication. Melandrinum is a remedy which is not often prescribed in our clinical practice, but if you read the Henry Clay Allen's Materia Medica of the Nosodes, then you will find a uh, lot of great symptomatology which can be useful in current times in clinical practice. Uh, Sometimes, if there is an epidemic of uh, chickenpox going on, uh, before you can work out a remedy, I have seen some clinical prescribers prescribe melandrinum as a prophylactic in these cases. Uh, but I still believe that uh, the, it is more important to prescribe a constitutional remedy as a prophylactic than anything else, or you have to work out a genius epidemicus. Um, the concept of genius epidemicus, as we all know, also depends on an analysis of the indications, which are different from the usual disease process. So we do not identify a genius epidemicus on the common symptoms of a disease. We do not uh, take all the uh, common symptoms, signs, modalities of any clinical process to find out a genius epidemicus. Rather, what we identify are the indications which are found in different individuals, and that is how we work out a genius epidemicus. Moving on to another case, this gentleman is who again we've been seeing for about 1.5 years or so now. And he consulted for right-sided varicose veins with deep vein thrombosis and recurrent episodes of thromboembolic phenomena, which led to pulmonary embolism. And he had been hospitalized almost every 1.5 to 2 years till he came to us at a young age. And when we saw him at that time, he complained of bilateral coughing, and there was dyspnea grade 3 or 4 with persistent chest pain, and the doctor had advised him for hospitalization again because they suspected pulmonary thromboembolism. So we went into an elaborate history again to find out the anamnesis of the disease. And the parents informed that in September 2015, he had a bike accident. His right leg was smashed. And a few days later, after recovery, he developed a painful lump over the lateral side of the right leg. That was treated with antibiotics and painkillers. And a few weeks later, he developed fever with dyspnea, chest pain, and eventually he was hospitalized. In a span of about 2 months, he was hospitalized twice, both the times for pulmonary thromboembolism. And so then he underwent hospitalization. Like I said, there was recurrent hospitalization. We could find out the records of the few hospitalizations that he had with the reports of CT angiography, the venous Doppler that was conducted. 2017, he was hospitalized again at Sir Gangaram Hospital. 2019, so just before he came to us, he had just been discharged from Gangaram Hospital, but the doctor said possibly, the pulmonary thromboembolism has occurred again, so he needs to be re-hospitalized. But somebody referred to us, and that's when we saw him. So the latest reports for the CT, lower lung venography, which was done about a year earlier, showed deep vein thrombosis. And the recent CT pulmonary angiography also confirmed pulmonary thromboembolic phenomena. So apart from this, the medical phenomena, he was also, his thirst or water intake was less. His appetite was good. He was unable to void urine completely. His tummy did not clear properly, and he also had hemorrhoids. He liked rains and winds, but he did not like winters. because he did not like layering up. But yeah, he preferred having AC on all the time. He liked cold environment. There were sweaty palms and soles. There was possibly offensive foot sweat. There was no strong desire or aversion that he informed us about. But yeah, he disliked ladyfinger and arbi. He preferred sleeping over abdomen. And if the AC or fan was ever switched off or there's a power cut, then he used to sweat behind the neck. The past history revealed that it was a difficult delivery. That's what the mother informed about. The labor lasted almost for 4 days, and there was a cord around the neck. Though he was a little heavier child with birth weight of about 3.5 kg, also had neonatal jaundice. At the age of 5 to 6 years, he was circumcised. And because he owned pets, there were numerous episodes of dog bites. But the family informed the dogs or the pets were always and regularly vaccinated, so he had never been vaccinated. And most of these bites were superficial, so he never really required treatment. As a kid, there was immense wasp bite with severe allergic response. So he was giving antihistamines and also injectables. And because he was not responding, so he was also possibly treated with corticosteroids during that time. And somewhere about 7 years prior to his visit, he had also received a severe electric shock. And he fell down and the limbs trembled for a long time, though he was conscious. We went on to the intrauterine history. He was the youngest kid with 2 elder sisters. Mother was cautious, and they underwent diagnostic sonography, and she chose to carry on the pregnancy only because she was expecting a son after 2 daughters. No abortions prior to him. The mother was euthyroid and normotensive and had normal blood sugar levels. During the last trimester, mother slipped and fell down over the back. And thereafter, she felt ghabrahat, a kind of restlessness, anxiety in episodes occurring time and again. She had a craving for strong syrupy sweets, and she was having nausea and vomiting throughout the pregnancy. So often she visited the doctor. Father suffered with diabetes, high BP, had suffered with tuberculosis earlier, also kidney stones and sinusitis. Paternal grandmother was diabetic and paternal grandfather had been hypertensive. Mother was hypothyroid, had multiple uterine fibroids and also gluten intolerant. And she was also having morbid obesity. Maternal grandfather had coronary artery disease, maternal uncles had diabetes. So when we look at the anamnesis, so it starts with the mother slipping and falling down during the later months of pregnancy. There was prolonged labor. There was neonatal jaundice. He suffers with severe electric shock. And then there was a road traffic accident in which he injures the right leg. And thereafter, the sequence of the events that follow from deep vein thrombosis to pulmonary thromboembolic phenomena. Also considering all throughout that he had pretty mild disposition. So the remedy was pretty obvious, arnica montana, which was prescribed to him in ascending LM potencies. And ever since we've started treating him, there have been no episode of pulmonary thromboembolic phenomena. And early last year, just before the lockdown, is when we sent him for a venous Doppler. And what we found was the venous Doppler study showed that he was recovering from a chronic thrombus, and there was only a partial chronic thrombus. And some of the varicose veins had also appeared. Arnica montana is usually considered to be a first aid remedy, and it's something which people take on their own. What people usually don't realize, it is a remedy which can also be useful in chronic conditions. Uh, uh, when you read the Materia Medica Pura, then Hahnemann also recommends it as one of the remedies which can antidote the effects of electric shock, that being another trauma to the body. It is also one of the remedies for the anxiety, or people who suffer with anxiety, with those uh, psycho-emotional traumas which the patient who is prone to anxiety and how they are subject to it. So trauma at all possible levels can be remedied with Arnica Bhutana, and this is what it did in this case as well. Another case that I share with you is of a 57 years old man who first visited us for a homeopathic consultation in May 2014. At that time, he primarily consulted us for a sensitive throat with a tendency for postnasal drip, which had been there since childhood. And he always felt that, his sensitivity to cold reduced if he covered his head properly after bathing. Uh, it usually started with a sore throat, which was followed by coughing, and then there was a postnasal drip, and the phlegm used to persist for a long time. So we had treated him with a constitutional homeopathic remedy, and he improved. And for almost a year, he did not have any complaints. And thereafter, he decided to discontinue the treatment. So in January 2018, he consulted us again, and that's when he informed that he was diagnosed as a case of thrombosis of the superior mesenteric vein. He was still euthyroid at that moment, and there was no history of blood of high BP or diabetes. So he informed that, in the beginning of January 2018, he had suffered with some tummy ache. He waited for it to subside with some home remedies, avoided spices and fried stuff. But when the pain persisted and increased in intensity, that is when he went to the local doctor, and he advised endoscopy. He also complained of burping, which required an effort, but avoiding wind was easy. And then concurrently, his older complaints of sensitive throat and postnasal drip also returned. With the stomach upset and the aches and pains and the discomfort, he was more comfortable with a fluid diet, and even semi-solids made him uneasy. So the ileocolonoscopy showed some erythema and erosion in the anorectal region. The duodenoscopy showed some laxcardia and esophagitis, which was H. pylori positive. The main complaint which he came for was the thrombosis of the superior mesenteric vein. And there was partial thrombosis of the left and main portal vein, thrombosis of the right portal vein, thickening of the proximal jejunal loops and associated with entry. With venous ischemia, there was minimal ascites. As you can see, this was the CT scan report, CT angiography report. So again, going back into the previous records, we found his past history that at the age of 8 to 9 years, he suffered with recurrent episodes of typhoid fever, which relapsed successively for the next 4 or 5 years. Later on, while playing, he had also fractured his left leg and left wrist, but they healed perfectly. He had lost his mother when he was a kid. She died with rabies. And father died his natural death when he was somewhere in his early 80s. His water intake was always poor. Uh, though he was hungry, but he felt that there was always discomfort. If he tried any solid food, he could not. Uh, he did not feel comfortable even after semi-solids, and he preferred having fluids. He was able to sleep well. His bowels were regular. His urine was regular. He always had dreams of falling, of fighting. He did not perspire much except on the forehead. Uh, he had liking for strong sweets, especially syrupy strong sweets. He preferred having cream. Uh, though he feels cold, but he preferred winters. His taste was normal, and it was he was working with Indian Railways at a pretty as a very senior officer, and he said that over time he's become uh, extremely punctual about time. He preferred always reaching someplace before time, and he said it was part of his job profile, and also therefore become his habit. So, based previously when we had treated him for recurrent sore throat and post-nasal drip, he had responded to typhoidnum. And because though there was no major change in his generalities, no major deviation, so that's when we decided to continue him on typhoidum in ascending LM potency. And he improved, the pain disappeared, and throat pain used to persist for a long time, came back on and off. There were a few episodes of diarrhea, but on the whole, he improved. And even over time, his sensitivity to cold went down. His uh, his throat sensitivity, his recurrent post-nasal drip, his episodes of feverishness, which had started occurring again as a concomitant to this problem, they also disappeared. And about a year into the treatment, less than that actually, about 10 months into the treatment, we asked him to go for a CT scan. And then all the thrombosis of the portal vein and the superior mesenteric vein had disappeared. All the ischemia had gone away. There was a little bit of ascites, which was there earlier, that had also disappeared. Uh, so what is interesting, especially from the homeopathic perspective, when we talk about the homeopathic anamnesis, if you don't know history, then you don't know anything. You do not even realize that you're a leaf that doesn't know it is part of a tree. The, the morbid manifestations that are present or a patient that consults us for today is a part of a morbific process, which is a dynamic process that needs to be understood as an evolutionary phenomena. And this entire circumspect view of life is critical for homeopathic prescribing, even when you say acute diseases, because uh, every acute manifestation, besides the common disease symptoms, always presents with unique individual features. And this is something that you can only identify by understanding the patient, the sick, with his unique circumstances and unique indications. This is all that I wanted to share with you. Thank you so much for your time. Enjoy your Sunday.
Thanks a lot,